Good afternoon. Thanks for taking the call today and the time. Regarding up here, a little bit of a different situation. Obviously, Alberta, 10 kilometers away, and Fort St. John and Fort Nelson being added to the high case areas with Dawson Creek, and then even today, just North Peace, numbers revealing over 1,000 cases, and then South Peace almost 1,000 as well. I was wondering, either from the minister or Dr. Henry, if there's any special consideration being, considered for the north as far as travel or stopping transmission or anything related to that, just because of the proximity to Alberta.
Yeah, and we know that it's been something we've been discussing with our colleagues in the north for a long time. We know that there's lots of reasons people travel back and forth, particularly in the North Peace and the Peace region, and it is challenging. We know that a lot of it is work travel. So we have done a concerted effort working with some of the large industrial camps and mines around those areas to immunize workers, and particularly the rotational workers who are coming through to try and reduce those risks. We saw a lot of that prior to Christmas, and there was a lot of outbreaks, a very challenging time. So we've been working with a lot of the businesses in the north to try and reduce the risk, build back up slowly, and that's been effective. It's working. But I also want to say, and we've been targeting a number of the communities for increased vaccine, increased immunization clinics, and we are hearing that there are some people in many communities who are reluctant. Fort St. John, there is challenges in people wanting to be immunized. So I would say everybody needs to reach out and talk to their neighbors, talk to their friends. You can see the issues that we're dealing with, and we all need to be immunized now. There's vaccine available for everybody. Northern Health is making it available in communities through a variety of different ways, and it right now is really important in those communities too. Yeah.
And just with respect to the peace, I want to express my appreciation to Mayor Ackerman, Mayor Bumstead, and the two large communities and community leaders across the region. If you look at along the Alberta border, a number of weeks ago, we saw relatively low immunization rates, and those are going up. We made a major effort a few weeks ago in Dawson Creek related to transmission in that community, but also as you go further down the border, further south along the border in the Golden Local Health Area, in the Windermere Local Health Area, the Columbia Valley, and obviously in Revelstoke, and we see the effect of that over a period of weeks. So I want to express my appreciation to everyone, including my MLA colleagues, Mike Bernier, Dan Davies, who have been working on this effort and convincing people both to get immunized. And we've seen a very positive response, I think, in the last week in Fort St. John. We've already seen a positive response in Dawson Creek, and we hope that that continues. It's important for people in those communities to get immunized, and in hotspot communities across BC to do so. And we see when it happens. We've seen it in the Columbia Valley. We've seen it in Revelstoke. We're seeing it in Golden. We're seeing it in Dawson Creek. We'll see it in Fort St. John. Get registered and get immunized.
Rob, do you have a follow-up?
I do. A couple of specific, or certainly less umbrella incidents up here. One was just over the past weekend, it being Mother's Day. I can think of many people that are going through certainly custody and all kinds of court issues, whether they're custody related or not. But I have a single father who, going into Mother's Day, does the exchange and then proceeds to watch the mother of the children literally drive to Alberta, go around the Mile Zero roundabout, and head off to, into Spirit River, Rycroft, up to Hines Creek area, which is obviously nowhere near the area. And then the other example in the North Piece, I can think of the Presbytery church gathering where the RCMP put out a release and clearly, to use an old school term, turned dime on Bell Media, who tipped them off. I was just wondering when it relates to, again, attempting to stop transmission, lowering risk, and holding the line, how does either the minister or Public Health and Dr. Henry expected that to, these numbers to go down when either enforcement seems to be letting people know who does tip them off, or in some cases, again, it seems to be a free-for-all as far as travel, regardless of what people think as far as what is safe and what isn't. How do I guess, what do you say to people that are still continuing to break these things? And then how does it work for the general public when, as again, colleagues like Mike Bernier are doing everything they can, and that, transmission is still out and about, so to speak.
Absolutely, and this is about human behavior, and we've known that from the beginning. There is a certain amount of enforcement that we can do, but it is all about us, and it's about us having that influence on those that our family, our friends, to ensure that they're doing their part too. But we recognize that this virus is transmitted when people travel and when we're close to people. And it can happen very quickly, and it can spread very quickly. So that's why it's important across the board to all of us to pay attention to these issues. And yes, it can be very challenging and frustrating when we see small, one or two visible actions like that, but overall, we know that people are doing the right thing, and we need to encourage and support people to be able to do the right thing. And we all know what that is now, and that is staying small, staying local, wearing masks when we're out in public. It also means now that we have ways of protecting both ourselves, our family, and our community, and that's where immunization is so important.